What comes to mind when you think about health and well being? Perhaps genetics, family history of illnesses, exercise, vegetables, meal prepping, vitamins, stress, self care. Just based off this list, it seems pretty clear that there are various factors that relate to and impact our physical health and well being. But how's that actually studied? So, these factors and health outcomes are studied in depth within the interdisciplinary field of health psychology. Health psychology is a field that integrates research on health and psychology. It involves the application of psychological principles to promote health and well being. The field is particularly important and unique because it considers factors outside of biological factors solely. It focuses on understanding how health and well being are impacted by thoughts and actions, and vice versa. And when we talk about well being, we're referring to a positive state that is sought by striving for optimal health and life satisfaction. Social context, biology, and behaviors all combine to affect our health. One of the primary models used in health psychology to discuss the impacts on health is the biopsychosocial model. According to this model, health and illness are influenced from a combination of factors such as biological characteristics, behavioral factors, and social conditions. Physical health outcomes are influenced by our lifestyle choices. Before the 20th century, most people died from infections and from diseases transmitted from person to person. However, in most developed nations currently, poor physical health outcomes like heart disease, diabetes, cancer, strokes, and death are often influenced by lifestyle choices such as excessive eating, smoking, poor exercise habits, things that oftentimes are in our control. There are large health disparities in health and well being and outcomes across racial and ethnic groups in and outside of the United States. This figure from the textbook illustrates how the life expectancies of black men have remained particularly low in comparison to white Americans. The reason for these disparities is a combination of genetic variation in susceptibility to some diseases, access to affordable health care, and lifestyle factors, in addition to the racial inequities and biases and racism that further maintain and exacerbate these risk factors. Similarly, in developing or impoverished countries, resources for treatments and healthcare are often lacking and can be responsible for younger ages of mortality and worse health outcomes. On the contrary, some nations emphasize healthy behaviors such as increased physical activity, commuting by foot or bike, and factors such as those might contribute to differences in health outcomes across countries as well. Another factor might include the level of pollution across cities, and that can really vary between countries, cities, and just your general environment. So, obesity has health consequences. Obesity is a condition that has been associated with physical health difficulties and can also be conceptualized through the biopsychosocial model. Obesity is highly influenced by genetic makeup, as you might notice this can run in families. However, the availability of food and the variety of food may have a large impact on eating behavior as well. Having access to several food options may increase habits of overeating, but also having limited access to food, grocery stores, and healthy food options is associated with obesity. Think about food deserts, for example, where the access to supermarkets and fresh produce is limited, or even think about the price of a salad compared to a burger at a fast food restaurant. If you're not able to afford or able to access healthier options in your environment, that can really impact what you're eating and putting in your body, and that can impact your health and weight. Lastly, there's some evidence that you and your social groups may implicitly agree on what is normal weight and what eating habits are normal. So, this could also impact how you think about food, body standards, and how you eat. And lastly, our BMI, or our body mass index, is what is used to identify whether someone is underweight, normal weight, or obese. However, there are a lot of limitations associated with BMI, specifically the fact that muscle mass is not taken into account, bone structure, and those things do play a role in our weight as well. So there's some limitations related to BMI. As many of you know, stigma has surrounded obesity in Western cultures for some time now. There are some notable shifts in this narrative, however, and there are greater efforts towards body acceptance, body positivity, and body neutrality as well. This stigma around obesity and ideals around thinness are not universal, however, and it can vary across countries and cultures, and in fact may symbolize high status and good health among certain groups. Unfortunately, some of these standards and stigmas around obesity and related dieting have been related to poor mental health, restrained eating, and disordered eating. We won't go into too much detail about eating disorders within this lecture. However, it is important to note that the primary eating disorders, anorexia nervosa, bulimia nervosa, and binge eating, are due partly to genetics and can run in families, but can also be heavily influenced by cultural standards and pressures. Eating disorders can affect anyone, although they've been commonly falsely associated with females only. Eating disorders can have long-term health effects if they're not treated. Fortunately, there are effective treatments, specifically ones that discuss how thoughts, relationships, and family dynamics impact eating habits and disordered behaviors. Given that eating disorders are not uncommon during college, I just wanted to take a second to highlight a couple of local and national resources that might be readily available if you or someone you know is currently struggling with an eating disorder. So we'll move on to our next topic now, our next health-related topic, smoking. Smoking is a leading cause of death, which many of us know, yet people continue to smoke. So smoking cigarettes has been responsible for over 480,000 deaths per year in the US and decreases the typical smoker's life by 12 years or more. So why do people continue to smoke? Well, it's pretty ingrained in our culture at this point, and also given the media coverage for other drugs and substances like opioids, people might be more inclined to believe that harder drugs like heroin and painkillers are the leading cause for death. But actually, it's tobacco. It's just talked about less in the media and seen more frequently and normalized at this point. Again, taking a biopsychosocial approach, we can think about the different influences and motivating factors that might be present amongst people who do smoke. So most people do try smoking in their adolescent years, and this might be because of social influences so that could be their friends, their parents, or family members who might pressure them to smoke or who might smoke themselves, and so seeing people smoke just becomes really normalized if other people around them are doing it. Status has also been associated with smoking, like looking really tough or cool, and these are images that have been portrayed in the media and in movies, and so that could be a motivating factor as well for why people are interested in trying out smoking. The addictive substance in in cigarettes is nicotine, and when people do smoke cigarettes, they aren't always immediately addicted to the nicotine, and part of this might be because of genetics, and some people might be more susceptible to becoming addicted. And another motivating factor to continue smoking includes the fact that oftentimes smoking cigarettes is seen as a method of relieving stress. So if you are, if you're trying to keep up a certain status, or you are just naturally addicted to the addictive substance, or you're using this as a method of stress relief, these are some ways that smoking cigarettes continues to be a habit. So you can quit smoking, and I'm sure many of you know this already, but I'm just going to go over some of these methods. So, although e-cigarettes are branded and marketed as methods of quitting smoking cigarettes, there isn't really a lot of data to suggest that e-cigarettes are effective as a replacement therapy. So, more research needs to be done on that and also on how harmful e cigarettes are, since there are other substances in those devices. So, e cigarettes provide nicotine without tobacco or many of the carcinogenic substances that are found in cigarettes, but there might be other substances related to the device, like I was saying earlier. And adolescent non smokers who do try smoking e cigs are more likely to become regular nicotine smokers than adolescents who do not smoke e cigs. So that's something to consider when you're really weighing how effective e cigarettes are as a replacement therapy for normal nicotine cigarettes. So, the other methods to quit smoking that have been pretty heavily endorsed or seen a lot over the years include nicotine replacement therapy. So, that might mean that could include nicotine gum or patches that still provide a certain amount of nicotine, but or that help with kind of curbing the cravings for smoking cigarettes. There's also prescription medications, behavioral treatments that can really focus on how to deal with stress and provide other methods of relieving stress rather than having to depend on cigarettes. Or people can just quit cold turkey, and sometimes that does work. Regardless, quitting is hard, and so a lot of health psychology research does focus on the topics of how to prevent smoking habits as well as treatments for smoking. All right, so exercise has many benefits and plays a pretty big role in our general health and well being. So, many of you are probably already privy to this, but more exercise is associated with better physical and mental health, better memory, enhanced cognition, and exercise also promotes the growth of neurons in our brain, which is helpful for our brain functioning and general functioning. Exercise is also good for our cardiovascular health. It can help us lower our blood pressure and strengthen our heart and our lungs. So, research suggests that about 30 minutes or more of exercise is associated with positive mental states, and even 10 minutes can make a difference in one's mood, even if it's temporary. Exercise has also been found to be beneficial for depression, addiction, and stress relief, and is often incorporated into behavioral treatments for mental health difficulties. So, although we can't necessarily say exercise leads to more life, we do see a lot of really strong correlations between exercising and healthy habits. So, if you're not already exercising, this could be something to consider, especially with the school year starting pretty soon.